last 2 days, we have been having a meeting with nearly 200 ophthalmologists from all over the country dealing with diseases of the eye, specifically caused by inflammation of the eye, as well as certain medical disorders like age-related macular degeneration, the vascular occlusions, as well as diabetic retinopathy. So these are the areas of eye, the retina. If it can be timely discovered by the competent ophthalmologist, so we can prevent these patients from going blind in a large majority of the cases. However, the technology is changing very rapidly. The means to diagnose these diseases, characterizing these diseases is undergoing rapid change. So we need to have our ophthalmologist colleagues who are not in working in non-academic institutions coming in and updating their knowledge, from time to time. And in this regard, this meeting is very, very important for updating them various aspects of these medical disorders of the retina and eye, as well as the inflammatory disease of the eye. These have started posing a major challenge towards the blindness overall in the population, sheer because many of these diseases would be asymptomatic, they would not cause any pain in the eye, so patient would ignore and would present late by and large when the vision is lost and nothing much can be done. So it's to increase the awareness not only among the ophthalmologists about these diseases and how we can diagnose them early, how we can treat them effectively, but also how we can increase the awareness among common people, so that anybody who has a diabetes or somebody who has a disease like sarcoidosis or pulmonary tuberculosis and a number of vascular disorders of the system, that these patients may have their eyesight compromised or affected. In this context, I'm going to deliver a lecture named after Dr. Saroj Agarwal, a great US ophthalmologist, dealing with a subject which is very dear to me, that how every physician and not only ophthalmologist can continue to learn all through their life, even when they are doing a solo practice and without the support of academic institution.
Good morning, everyone. My name is Dr. Manoj Khatri, founder and managing director of iDocs Eye Hospital based in Adyar, Chennai. We have conducted a 2-day conference on aspects of fundamentals in medical retina and uveitis, basically highlighting the blinding diseases covering the aspects of medical retina and uveitis. If not treated in time, how can this lead to permanent blindness and vision loss, and then uh, making the patients functionally blind. The concept and the idea of this conference was to train and educate people what's happening in the field of medical retina and uveitis on recent advances and also the technological advancements. And to our surprise, this conference have been attended by close to 300 ophthalmologists from across the nation, and the faculty comprises the best of national and international faculty who have taken out their precious 2 to 3 days to come forward and educate each and every doctor who has been part of this mega event. There's also oration which have been instituted in name of Dr. Saroj Agarwal from America, which has been delivered by none other than Professor Dr. Amod Gupta, an emeritus professor from Postgraduate Institute of of India, named as PGI Chandigarh, which is an apex institute in ophthalmology. We had a very encouraging response, and we hope that all the attendees will pass on the ultimate benefits to the needy patients and try to preserve the vision due to the needless blindness which can be treated well in time. Thank you very much. For further queries, you can reach us to our hospital which is situated in Adyar, and we'll be happy to help you further.